Hi, everyone, and welcome back. I am here with an amazing guest with such an incredible, rich experience in pelvic health and pelvic physical therapy. I want to welcome Dr. Kim Parker-Guerrero to the podcast.
Hi, thank you. Thank you, Ginger.
Yeah, I'm glad you're
Glad to be here.
here. Yeah, I
Glad to be
always want
here.
to do a little dance.
Yeah.
Makes
That
me
sounds
happy.
good. Sounds good.
Oh my gosh. Because we have a lot to talk about. And for everyone listening, I always kick it off with a little bragging on, on our guest and who is here. And I'm going to do that. But I just felt really led to say that this podcast is important because I think that in the condition and nature of our country here in the United States today, everything seems so divisive and partisan, and everyone is just kind of finding a reason to fight over politics.
Mhm.
And you hear stories behind the scenes. I know several Congress members who say that's not how it works behind the scenes. That a lot of people get into this kind of um, bit and bark and play because it garners media attention, which is
Yep.
kind of crazy, right?
Sad.
Yeah, it
Very
is. So
sad.
I wanted to say that if you're feeling a little disheartened and think that maybe your voice doesn't matter, your vote doesn't matter, or there's no way that we can create change in this partisan climate that we're in, this podcast is for you because you
Definitely.
can.
Mm.
You can, and we will, and we're going to talk about that and show you how. And we are going to do that in the context of pelvic health, specifically for women and people that give birth. So if you are wanting to see moms get better care, then you got to listen all the way to the end. Okay,
Yeah.
so now I want to brag on Kim a little bit. She has, oh my gosh, done so many amazing things in the field of physical therapy, you guys. When Kim, when you started, it was a bachelor's degree, right?
Correct.
And then you
Correct.
saw it change when I came into the field in the mid
Right.
90s, it was a master's degree.
Hmm.
And then both of us saw the transition to a doctorate
Doctorate degree.
degree. So
Correct.
I find that, you know, we had to chase each one, right?
Hmm.
Master's degree, then doctorate. So you
Hmm.
got your doctorate as well.
Hmm.
And then accumulated, racked up, I like to say, racked up a bunch of awards along the way. Um, 2005 New Mexico APT of the Year. Then in 10 years later, Clinical Director of the Year, as well as PT of the Year again, right? In
Yep.
2018. And then
2018.
Academy of Pelvic Health President's Award last year.
Yep.
Your volunteer work spans it's too much. It's too much to go over. So, if you
I
want to
like the
know
sentences.
everything that Kim has contributed to the profession of PT, which directly impacts particularly anyone with a pelvis, then you can go and find that easily online. You've also been a clinic director, obviously,
Hmm.
and a clinic practice owner,
Hmm.
which is important because that just provides so much insight into things that we're not really introduced to. So if you're listening and you're a PT, you might get a little bit of the entrepreneurial business, clinic practice side. And if you're
Right.
listening as, a person with a pelvis, then of course you're definitely going to get an earful on that. So there is something for everyone in this um, show today. So let's get started.
Sounds good.
All right.
Sounds good.
Um, so we think about things being rather complex when we talk about advocacy. Like everyone listening, you're passionate about something. And I think that because, we all have a mom, we may or may not know that mom, or a mom figure. Um, we all have people that we love and care about. And I think we all can agree that we want moms to get better health care. Because if you look at the statistics on maternal health in the United States and worldwide, but particularly in the United States, we have the highest maternal mortality rate. We have all this amazing healthcare, and then we have the highest maternal mortality rate, and it's even higher for people of color. And along with that, very sad similar statistic is that we have the highest first day infant death rate. So we're not getting it all right in terms
Mhm.
of the care that moms are getting. And it's not that it's not available. It's available when you can find it, if it's in your area,
Mhm.
and if you can afford it. And what I'd like to talk about today is how we can change that. But we think about passing bills and things like that in Congress is, oh my gosh, that is a complex process. And you're right, it is a complex process. But you have so much power and agency as an individual that your voice matters. And so I would love to hear from you, those of you, who are listening, and your stories. Please reach out when this is live on YouTube and Instagram. But I just want to say that you have a sense of agency and power, and that your voice can make a difference. And that's a simple process. But before we hit record, Kim, you were talking about a story, an
Yeah.
experience that you just had that is kind of a catalyst for everything we're talking about. Share that with me.
Yeah. So, I just opened up my private practice in started about June of this year. And I'd been in a hospital setting, a director, thought I had a big voice there. I live in rural New Mexico. And so I live in a medical desert. So patients drive 2 to 3 hours to see me. So even though I was over a therapy department, I had a very healthy pelvic health physical therapy practice. And a lot of the providers were, referring to me. The hospital decided, well, first of all, during the pandemic, they furloughed all of us. So they shut it
Oh,
down. So I treat a lot of pelvic pain patients also. My patients didn't have access to care. And then when we came back, the hospital wasn't really supportive of my practice. So I made the decision to open up a private practice. And so I was telling Ginger where I had these aha moments of why I'm still doing this and why I'm an advocate for our patients is I had a referral today from a midwife, an area midwife who refers to me. And mom walks in with her baby that she delivered in September. It's her second baby. She had complications after her first delivery, a 4-year-old that had never been addressed.
mm.
Um, because guess what? Small universe. She had been referred to me during the pandemic with the first
Oh,
one, and we were
oh,
closed. So she never
yeah.
got care for that. She comes in today and I said, I always ask, what are your goals? Tell me why you're here. I have the referral, but tell me why you're here. And she said, I never got an exam after my baby was born.
Oh,
And I said, what do you mean? Did you go back for your 6-week visit? Because, and we'll get into this a little bit, about some of the things when people are saying you don't need PT postpartum
mm-hmm.
because midwives or the gynecologists are checking and doing all of that work. This was just sounded to me. I was like, "Are you kidding me? You didn't?" And I said, "What did you do for that visit?" She said, we went back in, and she said they verbally asked if I had any issues. I said, no, I had hemorrhoids. I had this. I still had some issues from my first baby, and they said we're going to refer you to PT. But now, luckily, that midwife knew I was in practice. If they did not know that, then they would have sent this mom home
Mm.
for the second time with nothing, no advice. And she said, I don't know if everything's normal down there. I'm having some breastfeeding issues. I'm having a little depression because my 4-year-old isn't sleeping and I had this new baby.
Oh, so
Those are
hard.
things that we can all address.
Yeah.
And it just brought it home how important it is for our patients to have access to us in the
Mm-hmm.
fourth trimester. Because for those of you who haven't had a baby, I'll just say that, for 9 months, you get a lot of attention, while you're pregnant. The focus is on you, also on the baby, but really on you. Once you deliver the baby, the focus goes to the baby.
Mm-hmm.
Um, so you're kind of left on your own. And it used to be, in fact, she brought up, she said, my mom even asked me, didn't they check you? Didn't they tell you it's okay to go back to having sex?
Yeah.
And she said, they used to do that. So why don't they do that anymore?
Oh my
Um,
gosh.
so yeah, so
That's
in her exam, I mean, it's all I told her, I mean, if you could have seen the relief in her face and her body, when I was like, this is all stuff we can work on together.
yeah.
And while she's here with the baby, I'm talking to her about how she's lifting and how she's breathing, how she's lifting
Mhm.
the car seat. So it was very validating to have her today. And I thought really interesting since I had this call scheduled with you, Ginger.
Yeah, absolutely. When you said a couple of things that we should kind of do like they're like mic drops, right?
Yeah.
Um, One is it's going to be two-part here. So one is we have protocols for, like, I see lots of people with hip arthroscopy. We have
Mhm.
a 4-month protocol, which is a nice suggestion. But for my moms who are postpartum, it's like a 9-month protocol, right? And that's for hip arthroscopy. We have one for ACL, we have one for rotator cuff, and we have nothing for postpartum.
Yeah.
Nothing. Moms get 1 6-week visit, as you were saying, which we know is it covers hardly nothing. They're
Right.
looking for catastrophic things. I don't
Mhm.
even know that ACOG really is requiring, because the last time I looked, they weren't suggesting that it was mandatory to do, you know,
And
uh,
internal. Yeah.
and screening for depression
Right.
too.
Yeah.
Yeah. In fact, American Academy of Pediatrics was recommending it. But then you have the stigma of how many moms are going to go into their pediatrician's office and say they're having thoughts of harm, right?
Yeah.
That's hugely questionable. We're a
Right.
great safe space to be
Yeah.
screening for all of these things. So I want, everyone listening to just hear that we have ACL protocols, we have total knee protocols, we have total hip protocols, and Kim saying all the focus is on mom until she gives birth, and then after that traumatic event, which is also miraculous and wonderful and
Hmm.
amazing, life
Hmm.
changing, nothing.
Nothing.
And so
Yeah.
that requires us to define the fourth trimester, which is the second thing that you mentioned. So for our listeners, define and describe, like, what does that really mean, for moms?
Well, and that is, you when you're pregnant, they break it up into, your first, second, and third trimester. And so, it's also called your postpartum period, but it's after you give birth. It's that period after you've finished your pregnancy, you've delivered, and then you're now kind of, for most intents and purposes, you're no longer the patient. In the insurance world, in the medical world, there's no longer any need for you to have any care. But what studies have shown is that that's really when you need that focus, you to look at those things like depression, how you're eating. I mean, this woman wasn't drinking enough water and had some issues with her milk supply. I mean,
Mhm.
those are things we can spend more time with them than they are spending with their gynecologist or midwife, whoever. We can really look at we're trained to look at the whole body, to look at the total patient, and not just this is your pregnancy. But it's more, she wants to get back to running. She wants to get back to exercising. That's what she does for her mental health. This person is extremely, extremely intelligent. She was an engineer and she was nearly in tears because she said, I feel so stupid. I don't know my
Mm.
body. How many of us hear that a lot of times? Because
Mhm.
no one except us has taken the time to explain, here's why you're still having hip pain after a delivery. Here's
Yeah.
why, she said, I don't know why I'm sore because I didn't have an episiotomy this time and I didn't tear, but I did 4 years ago. But on her exam, that tissue was still very tender, just once I was explaining these things to her and what we could do and she could help herself, it was just like this weight was lifted
Yeah.
off her shoulder, you
Yeah.
know?
I
because she
can.
had been worrying about so many different things.
Mm-hmm.
On top of, again, she's going back to work. So she's in her mind trying to figure out, my body doesn't feel right. I have this new baby, a 4-year-old who doesn't sleep. And and she said, I'm very detail oriented as an engineer. I want to make sure I'm doing everything right. And
Right.
nobody's told me anything.
Right.
So during our one-on-one session with her today, I was able to really explain that whole postpartum 4th trimester uh, adventure, I called it, and told her how everything's going to keep moving along, but she has to pay attention to her body and not just the baby and the 4-year-old and the job
Mm.
and the husband.
Lots and
So
lots and lots and stuff.
lots and
So
lots of stuff.
goodness, you brought up several pieces of the argument that saddles women and people that give birth, and that's the cultural and social conditioning and burden that we haven't yet even begun to address because we haven't had leadership with the parts that give birth. Because if we had, guaranteed there would be help for that. So if we don't have any advocates, now is the time that we're changing that. There are solutions, and we're going to get to those in just a second. But for that mom to come in, that new mom, second time around, to come in and to hear from you, everything that you're feeling is part of the abnormal normal, meaning we're going to
Mm-hmm.
fix it. It's not okay, but it is kind of part of the process of
Right.
getting better, is vindicating, validating. It is the opposite of the gaslighting, whether a medical professional is deliberately, overtly, or covertly medically gaslighting
Mm-hmm.
a mom or a person that gives birth. It's happening.
Mm-hmm.
Like, we don't want to point fingers and say this profession or that profession is medical
Mm-hmm.
gaslighting. We can all do it if we're
Mm-hmm.
not validating the one truth that these people are not getting the care that they deserve after they give birth.
Mm-hmm.
Like, just to say that they are is huge. And
Right.
so if you're listening as a practitioner, please validate every single person that comes in, and tell them it's okay. You're not crazy. I would have depressive feelings too. Of course I did. I'm a mom times 3, right?
Right.
If I lived in a society with no maternity leave and where I'm self-employed and I have to go back to
Mm-hmm.
work at day 5,
Mm-hmm.
people don't take puppies away from their canine mothers until they're 6 to 8 weeks old. And
Right.
here I am going back to work at 5 days with a
Right.
human child.
Yeah.
Like, how insane is that? Like,
Mm-hmm.
new, is it colts and their moms, their mare and their moms, that,
I don't know.
you
Yeah.
don't take the baby
Right.
horses away, right? I don't know what they're called. I'm
Yeah.
blanking out, but we don't even do that to animals.
Right.
It's so important for them to be with the mom.
Yeah.
And yet we do that with humans, which is
And it,
crazy.
yeah. And I always, with my moms, my new moms, it's so funny because when I'm talking about on the phone scheduling, they'll say, I have a favor to ask. Can I bring my baby with me? Like
Oh,
it's this big
big
ask. And
thing.
I'm like,
Yeah.
I want you to bring your baby with
Yeah.
you because I
Yeah.
want to see, I can help you. There's things, because I always laugh, and we talked about this today. Moms will say, oh, I'm not exercising, I'm not lifting weights, I'm not
Mm.
doing anything. And I'm watching them as they bring in this heavy car seat
Mm-hmm.
and huge diaper bag, and they're lifting this baby, and like that, you're lifting weights.
You
You may
are
not, you're,
exercising.
yeah, you
Mm-hmm.
are exercising.
You
But even
absolutely
just in
exercising.
that short period of, we did a pretty thorough eval, and then the short period of treatment that we did before we scheduled her visit next week, she just said, you showed me that anatomy model and then you pointed out as you were doing it. And she said, I just thought I wasn't normal. And
Mm.
I want to have another baby, but I just, I don't know, but this all makes sense. And I will get better. I'm like, yeah, you will get better, but you're on your own. No one pregnancy is the same, and no one's journey is the same. And so
Amen to
that's what I
that.
told her. I
Yeah.
said, we just have to work together and, keep you moving forward, and make
Mhm.
it where it's things that are meaningful to you,
Mhm.
that are you're able to do. There's no guilt, there's no shaming on this, because she's like, well, sometimes my schedule's off. And I said, this is not a shaming session.
That's right.
We'll
Yeah.
tweak it, we'll make it work.
Yeah.
I think it was just such a relief for her,
Mhm.
to hear that, to be
Those are
validated
all the
like that.
green flags, those are the green flags that you want to hear. So for listeners, if you're looking at what your care should feel like and look like, it's what Ken just described. It is that validation. It is a shame-free environment. It is, please bring in your baby. We can help
Mhm,
you,
mhm.
get your crossfitting exercise in because that's what you're doing. You're basically crossfitting,
Yes.
especially once you get
Yeah.
two and then three, you're like, oh
Oh,
my
yeah.
gosh. I
Yeah.
was stronger, as a younger mom because I
Mhm,
was doing all that CrossFit stuff,
mhm.
lifting babies and toddlers. And I have to actually do boring things to get that
Yeah.
strong now,
Yeah. Yeah.
But then I always joke with moms and say, actually, I get to get my baby fixed. So, yes, please.
Yes. Yeah. Same here.
Bring
Same
that
here.
baby in. I love to
Yeah.
see the babies. And
Yeah.
then there's all kinds of things that we can do to help. So, you guys, all those things are the green flags that you want to say, yes, that feels right to me. I feel like I have a trusting, safe relationship where I can say anything. I can talk about painful sex or when I'm going to get back to sex or what else it could look like. It doesn't have to be
Mhm,
penetrative sex. I can
mhm.
talk about vaginal dryness. I can swear if I want. I can do whatever is needed.
Yep.
And it's going to be that safe environment.
Mhm.
Yeah.
Yep. Yeah.
So, other green flags. What are some other green flags for people listening who might not actually know what the pelvic health process for a PT with PT or OT may look
Mhm,
like in the postpartum? Because you and I, um, you spearheaded the prenatal and fourth trimester
mhm.
task force for Academy of Pelvic Health for American PT Association, and we'll talk about the direct efforts of that in just a minute. Um, but I think a lot of women don't know that, frankly, 100% of moms and people who give birth need to have pelvic PT or OT after.
Yeah.
100%. It's not if, because I hear that too often. Patients will come in and say, well, I asked my OBGYN for a referral and they said, well, you only gave birth. Why do you need a referral for pelvic
It's
PT?
normal to have that pain. It'll go away.
Right, right. Just
It's
wait.
okay. Your back pain will
Yeah,
go away.
right.
Yeah.
We've heard all of that nonsense, shenanigans and nonsense, right?
Right.
So let's talk about more green flags. What are the current standards? Ideally, what would the current standards of care be for you just gave birth? We know we've got that 6 week one visit out there in the wind. But what can we do optimally and ideally right after someone gives birth?
Well, and I know there's a big push out there right now for PTs and OTs in the hospital to actually see the
Hmm.
patient, the moms or the person giving birth before they're discharged, because they can work with them now, and try to. It's not. I think they think it's all about let's get the patient up and walk them and make sure they can walk to the shower and shower themselves before we discharge them. But as those many of us know, there could be pubic symphysis problems. They could be having some back problems that, they're too afraid to tell the nurse because they just want to go home, where
Hmm.
they might be more open to talking to the PT and OT about that. But so I mean, ideally, that would be great if in a
Yeah.
hospital setting they could get at least screened. I know that in the rural areas, we never had enough staff. So that the OB, department, those referrals were on the low priority if we got them. We started getting them when, again, I was the director and I could say, hey, you guys, the nurses need to be screening so we can help these patients before they go home. Because
Hmm.
then what happened is they're discharged and they did have problems. I wasn't going to see them until they went to that 6 week visit. Right.
Hmm. Yeah.
So I think if we can educate uh, the midwives, OBGYNs, primary care, whoever's delivering, and the patients to be their own advocate. I try to teach my patients to be an advocate, not be afraid to speak up and ask for a referral, or if you're in a direct access state like I am, then they can come directly to me, is educating them on not necessarily waiting till the 6 week visit to try
Absolutely.
to, especially if they're having any issues.
Hmm.
And so that we can get them in, we can see them sooner. Uh, Ginger and I were talking about, we look at the whole body. We're not just looking at the birth canal. We're not just
Hmm.
checking the episiotomy, or I always say giving the magic wand that they can have sex again.
Hmm.
It's more than that, and we can pick up on a lot of those things before the 6 week visit.
Yeah. I encourage the moms that I see um, giving birth that, like, for example, in my practice, I get booked out. So
Hmm.
if you're out there and you're going to give birth, I would encourage you to go ahead and establish a relationship with a local
Great
pelvic
point. Hmm.
PT or OT
Hmm.
prior, because I book 4 to 6 weeks out. And if you
Hmm.
wait till you give birth, you might actually have to wait several months to get in. And then you've missed a really vital window where you can progress and recover really
Really
swiftly,
swift. Yep.
safely, and you need less PT actually
Yeah.
in OT
Yeah.
if you
Hmm.
get in. So I try to get people in ahead of giving birth, because a
Hmm.
lot of PTs are doing birth coaching, and
Hmm.
OTs are doing birth coaching. So when I'm doing birth coaching, I say, go ahead, what's your estimated due date? Let's get you in for that first 30-day window, with good relationships with our OBGYN. And because there are so many things we can do without ever really needing to do internal,
Hmm. Hmm.
until later.
Yeah.
I know many of us, my clinic included, we have ultrasound imaging. We can,
Hmm.
non-invasively look and see how everything's doing.
Right.
And then you mentioning, we look at sleep, we look at feeding problems, we look
Hmm.
at stress management. How's their diet going? Are they getting enough fiber? Are they hydrated? Are there other endocrine disruptors in the environment that actually have an influence on hormone balance, which is such a huge issue when things are kind of going crazy
Right.
postpartum? There are so many things that we can look at without ever having to look up
Right.
in the vaginal
Exactly. Yeah.
canal.
Uh-huh.
So don't be afraid to establish that relationship early, and go ahead and book that appointment early.
Yeah. And I mean, and I do try to see them when they're pregnant. You know, a lot of times, depending on, I'm finding out from some of them, no one has talked to them about preparing the perineum, doing the massage,
Yes,
doing some of that
yes.
stuff. So, like you say, there's a lot of things that we can do to make their pregnancy uh, as good an experience as possible. Especially, I do lifting techniques and stuff when they're pregnant, if they have toddlers at home, if they're, so different things like that to help them get through the pregnancy. Like say, if we could screen them or see them before they're discharged, but then definitely booking out. I have a wait list also. So there's not a delay in their care.
Hmm.
The other thing I was going to mention is, if you have a very highly motivated, very a person that's really into exercise. I've had some moms who they go out and they start run. I mean, they start doing stuff they
They get
should
out
not.
there.
They get out there. They get out there, and I'm
Yeah.
just like, we need to, you can exercise, but here's what you need to do to work up to that.
Let's work up to it.
Yeah,
Yeah.
let's work up to let's talk about your breathing and how you're doing, all this other stuff. So, and that was one of the things with her too. She said, I really had to hold myself back because I wanted to go out and run, and because I thought,
Hmm.
well, if nothing else, at least I'll get back in shape. And she said, but something told me I should wait. I'm like, yeah, let's work up
Yeah.
to that,
Yeah.
because I'm
Yeah.
not talking, running a mile. She's like
Hmm.
long
She's in it
distance.
to win it.
She's in
Yeah.
it to win it. Very, yes, yeah.
Yeah. I had a mom come in, and this was a couple of years ago, because now she's already into her second and considering a third. But she came in after her first. No one had referred her. and she's had got high health literacy. So she knew she needed something,
Mhm.
and she knew it
Mhm.
wasn't right when her OBGYN said, well, you only had a baby. Why do you need a referral? Um, she had urethral tearing. She had labial tearing. She just didn't have perennial tearing. She had, oh
Wow.
goodness, lots of things happening that was creating prolapse. You know, the bladder wasn't happy. There was leakage when there shouldn't be, and without even a lot of stress. And here was the key thing, because a lot of things can happen, you know, if
Mhm.
moms do tear, which you don't have to tear.
Mhm.
Um, it was fear. It was fear. It was fear of if leaking and wondering, oh my goodness, what's wrong? Or I have pain when I do this, or just sit to stand, or try to do a yoga pose, or whatever it is. There's a
Mhm.
lot of fear that can surround it because you're not sure what it is. And so after her first, we just worked on if she had that right hip pain. I taught her to know that, you know, if try releasing that obturator
Mhm.
internus like I taught you, see if that's better. And then she could kind of almost diagnose herself, right? She had a sense of agency of knowing what was going on. So I'd always give her 2 or 3 things to try. She had pubic symphysis dysfunction, where, you know, for those of you who don't know about SPD, it's that pain in the front of the pelvis really low. It's a bony pain. It feels sharp
Mhm.
sometimes. And she had 2 or 3 things in her toolbox to pick out and go, when that happens, I'm going to try this.
Mhm.
And so she went through we were getting through, you know, that first postpartum recovery, and she came in and sat down and said, I'm pregnant. Which was like, congratulations. She was like, I know, but our rehab, like
Yeah.
now I said, we'll just shift it. We're doing prenatal rehab. We're going to finish your postpartum. We're
Mhm.
going to wrap it all up and do it together. Not
Mhm.
a problem. Anyway, thing is, you know, her second is now a year old. So this has been, you know, some
Mhm.
time has passed. She came in and she said, I just want to say that their second birth, which actually was a necessary C-section,
Mhm.
wasn't planned. You know, nobody plans for it, but
Mhm.
we plan tight, run loose. And so, you know, we talk about
Mhm.
the stress of what kind of
Mhm.
birth you want versus what
Mhm.
might end up happening. And so that
Mhm.
happened for her. She said, but I wasn't afraid. I knew
Awesome.
that I had prepared, you know, we did all the perennial stretching and everything
Mhm.
to prepare for not tearing with a vaginal birth. She said, but when they listed the reasons and gave me the informed consent, I wasn't afraid. I knew what was happening. And I started the prehab that I gave her for
Mhm.
postpartum, like right away.
Mhm.
And when she came in, within that first 30 days, she came in, we did imaging, we did all of the non-invasive things, and she
Mhm.
was doing so well with, you know, with tears in her eyes to
Mhm.
say the biggest thing for her, she said, the biggest thing for me was I wasn't afraid. And
You
when I had,
empowered her. You
right,
empowered her. Yeah.
and that's a huge green flag for
Mhm.
moms. She
Mhm.
is not being afraid. She said, I tell all my friends now, if that's one of the main things you can do is go find a pelvic PT or OT, because they will help you know what it is. Then you're not
Mhm.
afraid. You don't have to be worried about tearing. If you do, you know what to do. And that was just like the biggest gift to hear
Yeah.
um, about our profession, you
Mhm.
know, that it's beyond just the technical stuff that we're doing for people,
Right.
you know,
Yeah.
to help them
And
not be afraid is
yeah,
a
and
big
one thing
thing.
I've seen, again with the providers, OBGYN, the midwives, again in my medical desert, they really appreciate us all working together. I mean,
Yeah.
you hear a lot of times about, well, somebody's being threatened because, you're kind of on our turf and,
Right.
PT
All
shouldn't
those
do this or
turf
whatever.
wars. Yeah.
And all those tough words. Yeah. And they really appreciate because they know what their patients are going to get when they come to me. They know I'm going to have more time and be able to look at everything, which
Hmm.
is a little bit different than, what their practice is. It's
Hmm.
focusing on you're pregnant, we delivered the baby, and now, you know,
Yeah. They have an entirely different
it's a it's a
required
different
scope, you know,
right,
from what we're
exactly.
doing. And I think that's important to
Yeah.
impress upon people is that, you know, OBGYNs are trained to do so much amazing things and
Hmm.
life saving things, and they're trained surgeons.
Right.
We are not.
Yeah.
We have a whole different skill set to look at the nuances of the musculoskeletal system and how the musculoskeletal system is interacting with the endocrine system and
Right.
other parts and pieces so that we can take a
Right.
holistic approach that frees them up to do their job well. And so it's very synergistic, working with
Right.
nurse midwives, urogyns, OBGYNs. And so that kind of is a good segue to talk about how we what I first mentioned, that your individual voice can make a difference.
Right.
Um, Tell us about the bill that's out there. Tell us about that movement that I know we've been working on for a couple of years now
Hmm.
to bring all the professions together. So there's not, the OBGYNs are not fighting with the pelvic PTs or OTs.
Right.
And so we have a movement to create harmony, to create more synergy, and to make sure that no mom gets kind of left behind and
Behind.
that everyone gets the care they need. So tell me about
Right.
that.
So, yes, we started working a couple of years ago, the Academy of Public Health with APTA. We were looking at some different issues and patient advocacy issues. And one of the things that came up, and Ginger knows this, with the mentioned it, is with the fourth trimester task force. So we had a task force get together, and they worked on looking at what was care, what's lacking, what would be the best practice, how PTs could have a role in this. And it just happened that there was a legislator out of Washington that had wanted to have, or I think she'd had, help me remember this, Ginger, because we've had several iterations of this, but I
Yeah, I
think
believe
she had
she gave
had either,
birth.
she gave birth and had
Mm-hmm.
had some issues,
Mm-hmm.
and was like, why don't we have access to physical
Mm-hmm.
therapy? And so she had actually contacted someone at APTA. So we already right there had an advocate for us.
Huge
Uh,
thing.
so it just tied in with the work of the task force. And anytime you do a piece of legislation, and this was on the national level, you want to have bipartisan support.
Mm-hmm.
And Ginger knows, because she's very legislatively astute, it's hard on a lot of issues, and especially now, to
Yeah.
have bipartisan agreement on legislation. And we've never had that problem with this piece of legislation. I'm really proud of our task force. The language and the information they provided was used by APTA and legislative assistants to introduce a bill in 2022, and it didn't make it through to the final cut. Not because there was opposition to it,
Mm.
but because it was just, as a lot of things, got pushed to the
Yeah.
side to,
Well, I remember when it was read because we were all excited about it. When the
uh-huh,
notice came out, it got read on the floor of the House, I think in
uh-huh,
June.
mm-hmm,
And then the war in Ukraine started.
yep,
And
yeah,
that was it.
and that
Like,
was it. That
that
was
was
it.
it.
Yeah,
War took precedent over everything else. And then it got swept. But
right.
it was
But
reintroduced
yeah,
as,
so
hmm?
yeah, so now it's House Bill 2480, optimizing postpartum care, I believe. I don't remember the
Mm-hmm.
exact name of the bill, but so we worked with APTA again. We found our Washington sponsor did not get reelected. So we found two new co-sponsors, and we've had other people signing on as co-sponsors. And so it's scheduled, it's happening now, and unfortunately, right now the whole focus is on funding the government shutdown.
Mm-hmm.
So I don't know where this bill will go. But what I wanted to say real quick is, for everyone on the call, if you're a PT, um, go on to APTA's advocacy website. If you have patients that have given birth or are planning to give birth, you go on APTA's advocacy website. You can go on there and plug in your information, and there's an app also, but in the app, it will tell you who your legislator is. There's already a script in there that will say here's the bill name, here's the bill number, and why you're supporting it. If you have a story about a patient or you are a patient, that's always great, to share in this, email to your legislator. But I even, again, being in New Mexico, I reach out to, because they have their Washington staff and then they have their New Mexico staff.
Mm-hmm.
So I've reached out to their New Mexico staff. And so when I'm asking because this is in the House, there's not a Senate side. So when I'm asking my representative to support our bills, I not only contact the Washington staff, I call her staff in Santa Fe, and they're great. So they have me, on their list if there's a question about physical therapy or about this postpartum bill or any of the bills that we have right now that are kind of PT specific. I've asked them to contact me. And so that gives us and our patients a seat at the table.
Yeah.
And that's what I always tell people that are frustrated with government right now and like, no, they don't listen to me. There's nothing I can do. Your one voice does make a difference. It really does.
It
And
does.
if they hear from you as a practitioner, they hear from your patients, it brings a human face to that piece of legislation. And it kind of takes because they have to look at it gets so into the weeds of how much is it going to cost and who's this and who would oppose it and who would support it. But when we tell our stories and we share our patient stories, it just makes us stronger, our profession stronger, but it helps us advocate for our patients for better care and better access to care.
Yeah. Thank you for that. Um, so I'm going to do a little summary statement
Okay.
on the whole piece of this. We have so many collective stories that we have shared, because the stories that we have shared so far are the stories of thousands, and more than just thousands, hundreds of thousands of women that need care right now. And more than that, because over 86% of women give birth. So we're talking about millions.
Mm-hmm.
So what the bill would provide, because we don't know where it's going to go this year, but we do know we're not going to stop. We're not going to
Right.
stop until it's passed. So we'll work hard to get it reintroduced next year. So what we do know is that the more people who contact their Congress members, the more likely it will be to get picked up. Because I believe the last time I looked at it, it had at least 18 co-sponsors.
Yeah.
Y'all, that's a huge deal. It's not just
Mm-hmm.
one or two House members supporting this. It's over a dozen. It's
Yeah.
nearing 24 co-sponsors. That is significant in the House, and it's bipartisan. So what would the bill, mandate? It would mandate access to that postpartum care that would start with prenatal screening, so that every provider would understand what is necessary, what is indicated to refer someone and get that person to pelvic PT, which is incredible and doesn't currently exist.
Mm-hmm.
So everyone knows a mom, and most women become mothers, and a lot of people become mothers. Someone that you love very much that deserves that kind of care, that deserves to be screened. Let's just say it's 7 or 8 screening items. I can't remember what we had worked on the task
Yeah.
force,
Yeah.
but
Yeah.
let's just say they're looking at those screening items and they see 3 or 4 of the things that we've mentioned. That means they'll get a referral. And right now it doesn't exist. So I feel like I'm like making a big, plea. But we're not asking for donations, actually.
Yeah.
It's not a
Right.
commercial for a
Right.
donation. It
Right.
is, and we're going to put this in the show notes. There will be a very simple link in the show notes that will link to the bill. It will tell you what it's about. It's very simple in
Mm-hmm.
concept, just that it's helping moms and people that give birth get the care that they need and the referral that they need. And all you have to do is shoot an email or a phone call, which is literally like 2 minutes of your
2
time,
minutes.
to
Mm-hmm.
say, I am your constituent and I care about moms or a person that's given birth. Please support this bill. If they get
Yeah.
100, 200, 2,000, 200,000 calls because you just follow the link and commit 2 minutes of your time,
Right.
we have actually made a massive difference. And then we may come off of the statistical list as the country with the highest maternal mortality rate in the developed world.
Right. And, you may get the argument sometime, like, okay, well, PT's seeing them before their 6-week visit. You can't treat depression. You can't treat, if they're having excess bleeding or whatever. But that's not the point. It's that somebody has an eye and is focusing on that. And then we, like Ginger, you're saying, we refer them to the appropriate person sooner rather than later. So those issues can be addressed to
Yeah,
whoever scope of practice that is in.
absolutely. It's
And
about
so, yeah,
early intervention. Yeah.
early intervention.
Early intervention
Exactly.
and a holistic comprehensive management
Hmm.
that my friend and colleague Dr. Joe Tata is very big in mental
Hmm.
health, and we just finished our book last year on integrative and lifestyle medicine and
Hmm.
PT, and we contributed a couple of chapters apart and together, and one of the ones that we wrote together was how much movement influences mental health and depression and anxiety. So, there are so many tools that we have at our
Yeah.
disposal, just not even talking about sleep, just
Yeah.
talking about the old
Get
traditional
up and
thing
move. Yep.
people think PTs are responsible for, which is
Mhm.
movement.
Movement.
Very
Hmm.
encouraging that there's such a strong evidence base that
Hmm.
supports movement for
Hmm.
mental health. So,
Right.
we are excited to support the bill. We are excited to continue to support all the people out there giving birth. You guys deserve only the best care, and that early
Right.
intervention is key. So, check out the show notes so that you can make your voice be heard. And Kim, I just want to thank you so much for being on the show.
Thank you for having me, Ginger. I
Yeah,
appreciate it.
thank you. I've got one final fun question.
Okay.
What is the latest? It could be song, it could be an album, it could be music, right? Like the latest book or or song that's really or film that you've seen that you just really love.
Oh my gosh. I you stumped me on this. You totally stumped me on this.
Okay, well then I have a
Uh
question.
okay.
I just watched Barbie movie for the first time.
It's on my list. I haven't
Is it on
watched
your
it.
list? It
Yes.
just came out to
Was it
stream.
fun? Okay.
Yes, and I made my 3 sons sit down and
Oh, good. I
watch
heard it.
it.
Good.
Mhm.
Good.
It
Yeah.
does address a lot of topics, and it kind of like segues into our, people
Right.
listening to women in pain and women having issues. It's a good message. Yeah.
I'll have to watch that. It's on my list. So
Yeah.
anyway, but thank you so much for having me.
Thank you. Thank you for
All
being
right.
here.
Thanks to all your listeners. Oh, bye-bye.